Hello everybody, and today we'll be talking about walking to the beat of our own drum, exploring drumming in complementary care, presented by Sequoia, Zane, Elijah, and Clara. Today we'll be exploring the benefits, techniques, and research surrounding drumming therapy for enhanced wellness. Starting with our introduction to drumming therapy. What is drumming therapy and how is the treatment implemented? The general use of drumming techniques typically include drumming sessions that combine in circles, dyads, or individually. Sessions usually contain a similar experience of introductions / warm-ups, followed by a central or main component, and then finishing off with a closure to the end of the session. Drumming sessions usually range between 25 to 60 minutes, but may take a longer or shorter time depending on each approach or method. With drum materials slowly introduced in each session, participants repeatedly express a sense of client-centered and neurodiverse affirming occupational therapy approaches. To quote Bittman and others, group drumming is a complex composite intervention with long-standing historical roots that encompass the subject's full participation with physical, psychological / emotional, and cognitive involvement. Now we'll be discussing the key aspects of drumming therapy. From our presentation, we have boiled it down to 3 key points to highlight and discuss, starting with psychological well-being, then physical health gain, and lastly, community / social empowerment. Starting on with psychological well-being, studies from YAP and others discussed the various improvements in psychological health from lower cortisol stress levels, less anxiety, a useful non-pharmaceutical therapy for patients. In a controlled trial study containing the performance of samba drumming as an intervention, the results in effect discussed and showed that performance increases pain tolerance via triggering endorphin releases. As a complementary therapy, drumming therapy has been shown to improve the following psychological states: depression, stress, emotional trauma, and anxiety. Through a number of sessions with reports of improved stress reduction, emotional expression, improved moods, as well as cognitive stimulation that engages areas of the brain, like motivation and motor function. Lastly, another study discussed by Friedman, 2023, examined how drumming therapy with autistic clients demonstrated a potential improvement on the mental health and well-being while additionally addressing their social, emotional, and sensory challenges. On to the physical health gain. Regarding physical health benefits, various studies have examined drumming therapy with clients who have been diagnosed with Parkinson's disease, have measured and discussed the benefits of the intervention. A specific example of health rhythms resulted in drumming therapy helping improve physical symptoms like tremors, hand and finger dexterity, as well as upper body stiffness. While in another study conducted by Wainwright in 2025, measuring the impact of drumming-based music therapy interventions on people with Parkinson's and Huntington's disease. The results and effects examined how participants improved motor skills with the practice of dyadic instruments, while mentioning not only did it benefit the participants with Parkinson's, but also their caregivers, as the social interaction element reportedly improved in the study as well. By the end of the study, nearly 80% of participants and caregivers reported repeating or attending similar classes. Lastly, community / social empowerment. A highlighted element to drumming therapy is the wide range of client involvement. From age ranges and demographics to clinical settings, drumming therapy creates a sense of community and belonging among participants. It encourages teamwork and collaboration, which can lead to strengthening social bonds and reducing feelings of isolation. Lastly, drumming therapy has been measured to understand and foster a stronger connection with the motor, sensory, and social development between neurodiverse and neurotypical people. A quote from Yap and others is, "It is a modality that has been used in populations of varied backgrounds for the achievement of different purposes, and it could be a new activity with both physical and non-physical benefits."
Drumming has been an activity that has touched people throughout history with numerous cultures. One of the more notable cultures included indigenous people who actively engage in drumming circles as a core part of their culture. Albert Hall, a percussionist who studied under Nigerian percussionist and social activist Babatunde Olatunji, formed a group called the Village Music Circles in 1980 and facilitated drum circles in almost 30 countries. Through his actions, Albert was deemed the father of modern drumming circles. In 2001, neuroscientist Dr. Barry Bittman built a team with Carl Brunn, the father of music-making wellness, Christine Stevens, a social worker and music therapist, and Health Rhythms, a group dedicated to researching the effects of music in neuroscience. They developed and tested the efficacy of drumming therapy that we know today in research. Bittman and his team determined that their therapy increased the activity of natural killer cells and decreased burnout and difficulties in mood for those working in long-term care.
As for understanding the therapeutic technique and skills used from this therapy, therapeutic drumming utilizes techniques and skills derived from music therapy, such as the use of sound, rhythm, and harmony to assist clients, by assessing client needs and strengths, as well as identifying goals. Music therapy can be used to calm clients and assist with anxiety, depression, mood regulation, communication, social skills, and much more. There's also the two-lens approach, also known as two-eye seeing, which is a guiding principle of indigenous drumming therapy. One eye focuses on the Western ways of knowing, whilst the other represents indigenous teachings and connection to the world. Using both lenses in tandem is foundational. And then lastly, therapeutic drumming utilizes social and community learning and improves the associated social skills, as well as allows the client to represent themselves rhythmically through motor representation. Self-regulation is also an important skill that is used and improved upon through the use of drumming therapy.
Welcome to our drumming circle. Meet our friends Joey, Katie, and River. Notice the diversity in age, ability, the functions of their behavior, and the cultural backgrounds, yet all reaping different therapeutic benefits from the same session. Joey is an 18-year-old boy currently involved in drugs and violence and is in and out of rehabilitation and detention centers. Joey has issues with anger and verbal and physical outbursts, but uses the drums as self-expression, stress relief, emotional regulation, to release tension, and as a form of escapism. Katie is an elderly woman who used to love to dance and sing, but is now in a wheelchair living in a long-term care home, and is growing depressed due to less autonomy over her body. Drumming circles give her a sense of community, improved quality of life, and improved mobility. On the other hand, River is an indigenous man affected by the 60 scoop of residential schools, where he has traumas of practicing cultural traditions. He experiences a disconnect from self and cultural, spiritual, and emotional distress. Drumming therapy assists in reconnecting River to his traditional healing practices, a deeper sense of self, and releases trauma, and is a form of reconciliation. Overall, improving quality of life throughout a lifespan, this unique healing that resonates with diverse populations through a unified beat of the drums serves as a medium of communication and expression beyond words. Is everybody ready to participate in our own drumming circle? Trust me, this is easier and less stressful than you imagine. With simple follow the rhythm steps, anyone of any age and any ability can engage. So firstly, we'll watch this video on drumming techniques.
What I do is facilitate drum circles at nursing homes, hospitals for at-risk kids, youth, also for drug rehabilitation, things like that. One of the things we like to do with them is call and response. And so if I play something on the drum, they echo it back. Pepperoni. It really helps them to focus and also to lead and to follow. And stop. But even the ones who can't play, they come out and they're in the circle and they also are part of that circle and they're getting something out of it too.
The minute we pass out the drums and the drumsticks or the rhythm instruments, the room fills with noise and the drumming begins. It's a sense of community, a sense of belonging, a sense of participation, and they really love drum circles.
I like pepperoni.
I love it. There's something to look forward to in my week. It's worth the trip to get out of bed early, come down here, and you can go back and feel better than on a normal day. It's really good healing.
It's healing for me as well, and to share what I know and a little bit of knowledge I have about the power of music to others and see it come back, or someone says, hey, I really had a good time, or I wasn't feeling too good, but man, I'm glad I came. I feel much better now. lot of the people in the group, I'm older than they are, but they've had a traumatic experience, and I'm able to help them at least get out of that space that they're in. If it's a negative space or if it's not a healing space, I try to bring them out of that. And so to come here and be able to do that and see that, I think is a beautiful thing. And I think more programs like this that the county has, we should be doing more of this kind of work. I think it's very beneficial and very healing. Everybody should get involved.
Next, we'll be introduced to 4 different instruments and drumming patterns. Listen and try all 4 before deciding which resonates with you best. Remember, drumming therapy is a form of self-expression, so choose whichever you prefer. The magic happens when we all communicate together using music. So each, please focus on their own beat and let's create a beautiful song together. After practicing and choosing your beat, unmute your camera and join in. Great job, everybody. What's something you enjoyed about this exercise? Did you find any challenges? Did you notice any emotional reactions or personal insights?
As for the strengths of drumming therapy, Indigenous drumming is a sacred and traditional healing practice that has been used for many generations to connect us in a sacred way to our surroundings and Earth. It is a healing tool that respects Indigenous healing practice and connects physical, mental, emotional, spiritual, and cultural balance together in one therapeutic technique. It is calming, relaxing, and effective for creating connection, managing trauma, creating purpose, and spiritual connection. Lastly, it leads to social resilience as well as positive mental health benefits. Additionally, socialization and a strong sense of community are fostered through the use of drumming circles. As for the weaknesses and limitations, published literature on Indigenous drumming and healing in Canada is limited and calls for further exploration at present. This practice is still emerging, and more information is needed to support the practice as well as the practitioners. In connection to this, although there are calls for rhythmic therapies, including drumming, to be used, there is minimal guidance for practitioners that want to employ this technique into their practice. It can be difficult for one to adopt this sort of style, especially for those without a strong musical or cultural connection to drumming. Lastly, there is very limited research surrounding therapeutic drumming and clients with autism spectrum disorder. Much more research is needed to fully cement this as an effective technique for these populations.
There is current evidence that shows drumming therapy is effective not just for different ages, but for people suffering from different conditions. A study by Archambault et al. Looked at the effects of drumming therapy at a pediatric hospital. The team conducted 12 sessions, with participants mainly attending just one. After attending the sessions, participants, including the patient's family and workers, had an increase in positive affect and a decrease in negative affect. Participants additionally noted that the activity was also stimulating and stress relieving. A study by Atsuko et al. Conducted a 3-month drumming therapy study for older adults with dementia. Over the course of 3 months, the participants engaged in drumming circles 3 times a week for 30 minutes, 36 sessions total. After 3 months, the participants had an improvement in cognition and flexibility in the wrist and shoulders. They determined that this was a great low-effort exercise that could help improve the health of people who struggled to engage in more traditional exercises. A study by Fancourt et al. Determined that participants with depression and anxiety had improved symptoms and social resilience after a period of 6 weeks, and a further improvement after 10 weeks. There are still many other studies that explore the efficacy of drumming therapy and show that it can help people from different ages, conditions, and backgrounds.
In conclusion, as a complementary therapy, drumming therapy is recommended to patients with the concept of integrative medicine in mind. Here are references. Thank you for watching.